It is my distinct pleasure to introduce my friend and colleague, Dr. Andrew Dwyer. Dr. Dwyer is a board-certified family nurse practitioner with 20 years of experience in endocrinology and translational research at the Massachusetts General Hospital in Boston and the University Hospital of Lausanne in Switzerland. He received his Bachelor of Science in Human Development and Family Studies from Cornell University, Master's in Nursing from MGH Institute of Health Professions, and his PhD from the University of Lausanne. Currently, he is an assistant professor at Boston College, William F. Connell School of Nursing, external faculty nurse scientist in the Yvonne L. Munn Center for Nursing Medicine. His clinical focus is reproductive endocrinology, disorders of growth, puberty, and transitional care. He has worked in interprofessional research teams, has authored or co-authored over 100 articles, and presents internationally. He holds leadership positions in several professional organizations, including the Global Genomic Nursing Alliance, the International Society of Nurses and Genetics, Endocrine Nursing Society, and the Pediatric Endocrine Nursing Society. He previously served as vice chair of the European Society of Pediatric Endocrine Nursing and a nursing board member of the European Society of Endocrinology. In 2018, he was named a Distinguished Fellow in the National Academies of Practice and was inducted into the American Academy of Nursing in 2020. He was recently appointed to the Massachusetts Rare Disease Advisory Council 2021 to 2022 to inform the governor and legislature on policy affecting rare disease patients. Dr. Dwyer is an NIH-funded researcher who utilizes patient engagement and digital solutions to address key challenges in genetic literacy, genomic healthcare disparities, and transitional care. I give you Dr. Andrew Dwyer.
Hello, everyone. My name is Andrew Dwyer. I'm an assistant professor at Boston College, and I'm also an investigator at the Massachusetts General Hospital in Boston. And it's my pleasure to talk to you today about transition to adult medical care. So here's a little bit about what we'll be talking about. First, I'd like to describe what is transition, and then we'll talk about some barriers to a smooth transition to adult-oriented care. Then I'll give you a couple of examples of how folks have navigated that transition to adult care, and then share some resources with you and give you some questions for reflection and some questions to begin a discussion with your healthcare provider. And then we'll finish with some take-home points. So what do we mean when we talk about transition? Well, for this talk, I'm talking about the period between 16 and 25, which relates to a purposeful, planned process to move people from pediatric care to adult-oriented care. And you can really think of this as a bridge, and it bridges a number of different things. First, it's a bridge from childhood to adult-oriented roles. It's a shift from more dependence of childhood to more autonomy and independence. And it's also a shift in care from one that's focused on the family to one that's primarily focused on the individual. So why is transition important? Well, first and foremost, it's about continuity of care. And continuity of care is well understood to have important links to both improved health outcomes as well as improved well-being and improved quality of life. So this transition period is a really critical part of someone's health during their lifespan. So what are some of the barriers that make this challenging? Well, we can think about a 15 or 16-year-old individual, and we can say ready, set, but is someone ready to go? And there are a number of barriers. So one may relate to physical development and emotional maturity, support from family, as well as external stressors, one's ability to cope with the situation of being more independent, peer support, as well as what resources are available, and the healthcare team. How well are they able to support an individual as they move to adult care? So I like to think of this as a puzzle. So I'll present to you 4 parts of this puzzle which contribute to making this challenging. So the first relates to adolescents and young adults. So adolescents and young adults have specific developmental needs. They're growing autonomy and independence. They're developing their identity of themselves and the world. They also have an increasing role of peers and peer pressure. And also the timing of diagnosis, whether somebody has a diagnosis in childhood or in adolescence, makes a difference. And this idea of chronic care, meaning that this is a chronic condition which requires ongoing treatment and the skills or deficits that someone has to care for themselves. For the family, this can be a really challenging time of letting go. They have a great need for communication as well as support during this process. And for genetic conditions, there's often associated guilt that parents may feel. And many of these conditions are complex and they're difficult to understand. And they may have certain expectations about what should or should not happen. For the healthcare system, there's often a lack of a structure or a designated coordinator to manage this transition. And there's often the involvement of non-traditional contacts, such as email or patient portals or text messaging. How do medical records get transferred from pediatric to adult settings? And how do we make sure that this is a timely transfer? So there's not an 18-year-old person sitting in a little small chair in the waiting room in the pediatrician's office. And for healthcare providers, this is also challenging. So there's a great need for communication between the pediatric and adult providers. How do we assess someone's readiness to move and move on? Also, how do we delineate the responsibilities? Who's responsible for what? Is it the pediatric group or is it the adult group? And there are cultural differences. So in pediatrics, if someone misses an appointment, there's usually a scramble to get somebody back in a much more cocooning environment, whereas in adult-oriented care, there's really the focus on independence and autonomy. So this is a summary table from a nice paper that was published from a group from Stanford and Colorado. And they outline 3 challenges to transition and they propose some responses. So the first is self-management, how one takes care of themselves. And the important keys here are therapeutic education, coaching, and behavioral therapy, that building that confidence so that somebody believes that they can make that next step to adult care. And the goals are to improve adherence to long-term treatment, to build that sense of self-efficacy or the belief that I can do this, improve health status, and decrease unexpected visits to the emergency department or their primary care provider. Secondly is to engage the receiving team. This is about mobilizing providers, particularly in the adult side, and using telemedicine or mHealth, mobile health technologies to support that transition. And the goal here is to create continuity of care, so a seamless transition from pediatric to adult care to improve patients' quality of life and also to improve the experience of not only the patient, but also the family and the caregivers and the providers. And lastly, guiding patients and families. So involving a team approach. Many conditions, chronic conditions, require a multidisciplinary team of different specialists, and using checklists to make sure we're being rigorous and following all the things that need to be taken care of during this critical time. And the goal here is to improve satisfaction with care, improve quality of life, and to engage people in decision-making so that they can be involved in the important decisions in their health. So let's go through some examples of transition. So there are many models, but what I'd like to present to you is the MGH-Klinefelter syndrome clinic. So this is the only clinic in New England dedicated to Klinefelter syndrome. They serve patients from a wide catch basin, including New York and across New England, and they embrace a holistic approach to provide comprehensive care throughout the lifespan. And they really use a personalized approach. They focus on clinic coordination and effective use of the electronic medical record to make sure providers are sharing information. And they serve patients from prenatal consultations to adulthood. And in fact, currently their oldest patient is 73 years old, and about 40% of their patients are pediatric, and the remaining 60% or so are adults. And they provide comprehensive care that includes genetics and genetic counseling, psychosocial support, endocrine care, including testosterone replacement, as well as consideration of fertility counseling and preservation as appropriate, psychological and psychiatric care, and lastly, research. So this is really a comprehensive lifespan approach. And in this setting, transition is not really relevant because patients are taken care of from childhood all the way through adulthood in the same clinic. But what if you don't have access to this? I want to share an experience from the University of Lausanne in Switzerland, where I worked for several years. And we developed a program to move people, young adults with chronic endocrine conditions such as Klinefelter syndrome, from the pediatric hospital to the adult oriented care. And we had three main goals. One is to try to help people adapt to the new environment and negotiate adult healthcare services. Two, to build skills to participate in decision making and develop those critical self-management skills. And lastly, to support coping. So this psychological adaptation of being independent and responsible for oneself and being able to acclimate to a more adult life. So you can see these triangles here showing the pediatric setting. And then as you move from left to right, there's an increasing role for adult endocrinology. And so what we did is we started by focusing on pediatrics only. Then they visited the adult space to get acclimated. And then we had joint consultations. The first time the pediatrician takes the lead and the adult provider takes the background seat. The next visit, the adult provider takes the lead and the pediatrician takes the background seat. And progressively, we wean the parental involvement, decreasing over time until the patients are seen only as adults in the setting. And to help patients, we had nurse navigators as transition coordinators. And one nurse focused on endocrine conditions and the other focused on diabetes. And these nurses conducted individual evaluations to identify what were their needs for developing self-care skills. And then they developed personalized interventions, including some mHealth, which I'll share with you, that mobile health technology. And then they assessed readiness to make sure that these individuals were able to make the leap. So what were the outcomes? So the gray bars here show you the historical data. So you can see more than 10% of patients were lost to follow-up or had a big gap in continuity of care. And 80% were seen in private practice. These were not specialty centers with multidisciplinary care. So that was really suboptimal. And less than 10% were seen in a specialty center. After we implemented this program, you can see that virtually no one was lost to follow-up to care, and very few patients, primarily because of the geographic distance that they had to travel to the hospital, opted to see someone locally. And most patients, 86%, were followed at the multidisciplinary care at the university hospital. So quite successful. And we know that teens and adolescents use technology. And this is a figure from the Pew Research Center from 2018 that shows that adolescents, you can see here, use lots of different social media and technology to find information and to communicate. And they frequently use YouTube and Snapchat. So thinking about how adolescents and young adults use this technology gives an opportunity for us to help support them in a new way during transition. So what we did is we focused on developing electronic or e-health or mobile or mHealth interventions. So we matched providers from pediatric and adult settings. Those were endocrinologists, nurses, dietitians, and we worked with a design and marketing team. And we created an electronic ebook that this was focused on type 1 diabetes. And it had multiple chapters that focused on relevant aspects for managed self-care of type 1 diabetes. And so the patients at each visit would review this mobile health technology and have a discussion with the nurse to promote that self-management and build those self-care skills. And that was really well received. So now what if patients don't go to a university hospital? What if they have to go to the community setting? Well, we still wanted to focus on fostering independence, building skills, and supporting coping skills, those three key concepts for transition. So what we did is created an alternate pathway, and you can see at the bottom, moving from left to right is the pediatric care during transition to adult care. And during this process, we had nurses who were assessing self-care needs and providing therapeutic education, giving psychological and emotional support, as well as self-management. Sometimes this was face-to-face, sometimes it was email, sometimes it was text messages. And the whole focus was promoting independence and autonomy. And there was a staged approach where we assessed people, gave them an idea of what to expect, assessed their readiness, figured out what they needed to learn for self-care, identified a provider who they were going to transition to, and then made sure that those records got to the adult provider. And then the nurse would accompany the individual to the initial visits and ensure that this transfer of care was made and provided ongoing emotional support. So what were some of the outcomes of this type of transition? Well, I conducted a study with some graduate nurse students, and these are the things that patients said. They valued the fact that the nurse considered them as a complete individual interested in more than more about them than just their diagnosis, that they respected their privacy, that they encouraged hopefulness, that they took their basic needs into account, and gave them opportunities to develop self-care. And really what this comes down to is helping people develop the knowledge, the skills, and the attitudes that they could successfully move to adult-oriented care. So just as a summary, I think the important point here is an individual approach to the whole person. So part of this is about disease management. For Klinefelter syndrome, this means thinking about testosterone levels and bone health, trying to minimize metabolic and clotting risks, also paying attention to cancer and autoimmune risks. But we shouldn't neglect health promotion. So this includes paying attention to physical activity, diet and nutrition, controlling weight, and having regular dental care. Also, overall well-being, with paying attention and being sensitive to self-esteem, sexual function, fertility concerns, as well as relationships and support. And lastly, that key role of therapeutic education, coaching for behavior change, supporting self-care, and promoting long-term adherence to treatments for chronic conditions. So let's talk about some resources that may be useful for you as you ponder transition to adult care. So first, I want to say that transition is a process. It's not a singular event. So this is about 3 phases, and there are 6 steps. So the first, from a provider or healthcare professional perspective, is to share with patients and families that they are going to transition. So having a policy or a guide. And once that's done, between 14 and 18, really focusing on tracking and monitoring people's progress, developing their self-care abilities, assessing their readiness, and beginning to plan to transition to an adult provider. And once that's done, it's really about transferring the care to the adult provider, making sure they have the medical records, and making sure that the transition is complete. And then we can celebrate when this challenging process is done. So I call your attention to the link at the bottom. This is a wonderful resource. I will share some materials from that will help you think about and guide an effective transition. So question, are you ready? For parents and guardians, I ask you, is your adolescent or young adult ready to transition? And this is a great quiz that you can take, which will give you some pointers to assess readiness. And for adolescents and young adults, there's a similar quiz, which will help you think about what are areas that will help you feel more confident as you move into adult-oriented care. So for parents and guardians, I invite a few questions for your reflection. Number 1, I invite you to think about, what are my child's strengths and limitations? Is my child ready to transition to adult care? How can I support my child's independence? And am I ready to step back? And again, this comes back to the idea of it's an individualized process of transition. So to start the discussion with your provider to create a plan, here are some questions that may be useful. When does my child start to meet with you alone as part of his visit to increase independence? What does my child need to learn? And is there a checklist of self-care items that they should be focusing on developing? Can I work to prepare a medical summary for the adult provider and an emergency plan? And what information about privacy and consent do we need to think about? And if my child needs some help with making health decisions, where can I go to get information? At what age are you expecting my child needs to change providers? And do you have a specific recommendation for an adult provider? For adolescents and young adults, here are some questions for you. What are my concerns about transition? What am I worried about? What can I do to feel more confident? And how do I want my parent or guardian to be involved? And if you're worried about this, I say this. Are you worried about transition? You can do this. So here's some questions for you, and they touch on some of the same topics. This is a great question to ask your doctor or provider. When do I start meeting with you on my own? What do I need to learn? Are there checklists or things that I can develop to be more confident? Can I work with you to prepare a summary to describe my needs for my new provider? And what do I need to know about privacy and consent as I turn 18? And what age do you think I should move to a new provider? And lastly, do you know someone who you can recommend? These are all great questions to start a discussion with your healthcare provider. So we know that Klinefelter syndrome has lots of different dimensions, lots of different things to consider. So we aim to develop a mobile health tool to help people during transition. And what we did is we first reviewed charts, and we found that lots of people with young men with Klinefelter syndrome had gaps moving to adult care. So then we did a scoping review of the literature to see what's known about adolescents and young adults with Klinefelter syndrome. And then we developed a transition tool, or the transition passport, and then tested it with the help of some of you. So this is a picture of the Klinefelter syndrome transition passport, and we invited people to evaluate it using the patient education material assessment tool, which is what we call the gold standard for patient education materials. And those items which are greater than 80% are considered high quality. And what we found is that all of the items, in terms of the word choice, the use of numbers, the design, and actionability, meaning do people understand what to do with the information, were considered high quality. The only thing that was below that 80% threshold was the use of visual aids, so we can always improve. And in terms of how usability was, this is how easy it was to use the tool. Most individuals rated it fair to excellent, and there were some folks who thought there could be additional improvements. So again, there's always room to improve the work that we're doing. So let's finish with some take-home points. So I hope that you realize that transition is a process rather than a singular event, that continuity of care is really important for health and well-being, and that there are many complicating factors related to adolescents and young adults, family, providers, and the health system, but that a structured planned transition can help improve outcomes. And lastly, collaboration and communication are key aspects. So beginning that discussion is a really important step in this process. And I hope that you feel more comfortable, equipped with some questions to be able to do that. And there are resources available to help you. Again, I refer you to Got Transitions. I'll share some materials for those. And also perhaps the Klinefelter passport, transition passport may be useful. And lastly, I believe that technology and mobile health may offer new opportunities to help support young adults as they move into adult-oriented care. So I want to thank my collaborators at the University of Lausanne, Massachusetts General Hospital, the City University of London, and the students who work with me at Boston College. So thank you so much for your attention, and I look forward to meeting you virtually and responding to your questions at the meeting. Thanks so much.